ASteffens. My name is Alicia, and I'm a respiratory therapist here at the clinic. I work with your pulmonologist, Dr. Evans, and I'm here today to talk to you about your lung disease, your new treatment plan, and to answer any questions that you may have.
Oh, good. Dr. Evans told me I have something called COPD. I don't really know what it is. Do I have this because I smoke?
Well, smoking is one of the causes of COPD, although there are some cases where non-smokers do develop this lung disease. So exposure to irritants over time, such as cigarette smoking, can damage your lungs and make it hard to breathe. COPD stands for chronic obstructive pulmonary disease, and it's actually an umbrella term where a few different diseases fall under that. One of them is emphysema, another one is chronic bronchitis, and more recently, asthma sometimes falls underneath that category. Sometimes asthma patients will later develop COPD or have an overlap with COPD.
I have been told in the past that I probably have emphysema.
Okay, yes. And have you ever gotten short of breath before? Okay, yeah, that can be very scary.
You're the same.
So what happens is I have a model to show you, but this is a picture of a normal healthy airway. So you can see it's nice and open and you won't have any trouble breathing. But when you have something such as a flare-up, which is what you were telling me you've had, what can happen is maybe there's increased mucus buildup, and you can see the hole now is much smaller to breathe through, which makes you feel short of breath. Or sometimes what can happen is the muscle around your airway constricts and it presses down, and again it makes that hole harder to breathe through. Now I do want you to know that COPD is a progressive disease. There is no cure, but you can take steps to protect the lung tissue that you do still have. Steps like quitting smoking, preventing flare-ups, exercising, and using your breathing medications properly.
Yes, I really want to quit smoking. When I had my breathing attack, it was really scary.
Yes, that can be extremely scary. Now, have you ever tried to quit smoking before?
Yes, but I've never been super serious about it.
Okay, well, I have some information I can give you regarding smoking cessation. So it's information that talks about maybe different medications you can possibly try out, or it has examples of ways that other patients have quit smoking. That might be something you want to try. Is that something you would like me to give you information on?
Yes.
Okay, great. And also what is helpful is if you set a quit date. So you have a goal, get a date in mind, and then you have a plan in place. And this can make your quitting smoking more successful. Okay, so let's go over now your treatment plan and talk about the medications that Dr. Evans has prescribed to you. Have you ever used inhalers before?
Yes, I have a red one at home. When I was having my breathing attack, I used it a lot.
Okay, so good. You have some experience with. So when we're talking about breathing medications, there's two main types. One is called your rescue inhaler, and that is often albuterol, and it sounds like you've had that in the past. And the other one is what we call maintenance inhalers. So rescue inhalers, those are the ones that you take when it's hard to breathe. They give you quick relief. Maintenance inhalers are something that you take every day, no matter how you feel. And their job is to keep your lungs open and prevent you from having a lung flare-up. So let's first go over the rescue medication. In your case, it's albuterol. Now, have you ever seen this device before?
I have not.
Okay, so let me show you how to use it. So what happens is if you use the inhaler by itself, Oftentimes when you spray it, some of it gets wasted either in the back of your throat or it goes out the sides of your mouth. So we have this spacer, also we call it an aero chamber, and it basically helps you get more of the medication. So what you're going to want to do is shake your inhaler and just stick it in the back here. And now when you spray it, first it gets into this holding chamber, and then it's not going to release the medication to you until it detects your breath. So again, it just helps guarantee that not as much medication is going to get wasted.
Okay.
All right, so I've shook the inhaler. Now first you want to exhale all your air out, and then you're going to make a tight seal on the mouthpiece, and then you can go ahead and press down on the inhaler. Once you've pressed down, you're going to take a slow, deep breath in. So it's a, and then you're going to do a breath hold. Try to do 5 to 10 seconds. That breath hold allows the medications to get deeper down into your lungs. Now, Dr. Evans has prescribed this inhaler 4 to 6 hours as needed, 2 puffs. So again, you're just going to use it when you feel like you need it if you're getting short of breath. So you've taken this first puff, wait a minute before you take the second puff. You want the first puff to start working, do its job, and then go ahead and take the second puff.
Okay.
You want to give it a try?
Sure.
Okay. All right, so you want to exhale all your air out. Good. And then you're going to put your lips around the mouthpiece. Perfect. And then go ahead and press down on the inhaler. And then take that slow, deep breath in. And you're doing a breath hold. Great. Okay. So one suggestion I would make is to breathe a little bit slower. You were breathing a little too fast there. I don't know if you heard that little whistling noise. That just lets you know you're breathing too fast. So let's go ahead and try that again.
Okay.
Okay, good. Blow out your air. Perfect. Good. Nice deep breath in. Great. That was great. That was perfect. Okay, any questions on this one?
Nope.
Great. All right. So let's move on to your maintenance inhaler. And this is called Advair. Now, have you ever taken one of these before?
I have not.
Okay. So again, this one's prescribed 1 puff twice a day, so morning and at night. And again, it's very important that you take it every day, no matter how you feel, even if you're feeling great. That means it's doing its job. Now, this inhaler is different than albuterol. It's a dry powder, and it also has a steroid in it. So with this one, you're just gonna open it up. You're gonna push down on the lever. Now the medication is ready. You're gonna seal your lips around the mouthpiece. Take a fast, deep breath in. And hold your breath for a few seconds and let it out. And this is just 1 puff. Now, what you need to know about Advair is there's an inhaled steroid in here. So you do need to rinse your mouth out after you use it.
Okay.
All right. So after you take that deep breath in, you're gonna just get some water, rinse your mouth out, swish it around, and spit it out. All right. Any questions on this one?
Nope.
Okay. Now, I have seen that Dr. Evans also ordered a pulmonary function test. Have you ever had one of those done before? Okay. You would probably remember if you had. So it's a very specific lung test, and what it does is it gives a picture of what your current lung function is, what your current capacity is. All right. Remember I was talking about if you may have some lung tissue damage?
Yes.
So the test will let Dr. Evans know if you have any lung tissue damage and how much, okay? So make sure you take a look for that appointment and go ahead and go to that appointment. And just to give you an idea, you're gonna be in an office where they have this, it almost looks like a telephone booth, and you're gonna sit inside and they're gonna have you be doing different breathing maneuvers, okay?
All right.
All right. Now, Miss Steffens, do you ever get short of breath?
Yes, I have trouble breathing sometimes when I walk upstairs or walk long distances, or even getting my groceries out of the car.
Okay, so I do have something that can be helpful. It's a breathing technique that is useful, especially with COPD patients, because what can happen with COPD is you get air trapped in your lungs, meaning when you exhale, you can't exhale all of your air out. And when that happens, you have trapped air in your lungs that's taking up space. So there is a breathing technique called pursed lip breathing, and it helps to actually exhale more of that trapped air out, okay?
Okay.
So it's really simple, and I'm gonna show you how to use it. You're gonna breathe in through your nose, but when you blow out, you're gonna blow out through pursed lips, so a smaller opening. Sometimes it helps if you pretend like you're blowing out candles. So I say, smell the flowers, blow out the candles. You wanna go ahead and give it a try?
Sure.
All right, deep breath in. Perfect. Is it pretty easy to do?
Yes.
Okay. So when you're doing activities, or anytime you're feeling short of breath, really, when you're doing activities, maybe you just went grocery shopping, go ahead and use that breathing technique. It really helps.
Okay.
And the more you do it, the more it will just become second nature, and you'll probably start doing it without even thinking, okay? So
Okay.
anytime you're short of breath, or if you're just anticipating, I'm gonna be doing this activity, I'm gonna get short of breath, go ahead and use that breathing technique.
All right, thank you.
All right. So another thing I have that I wanted to talk to you about was a COPD action plan. And this is something that Dr. Evans will work with you and fill out. But it is something that will be helpful. It's something that you take home, put on your fridge, and it's gonna be a guideline to just help you to know maybe when something's going different with your breathing, what do you do about it? Because I know COPD is fairly new for you, right?
Yeah.
Okay. So if you take a look here, there's 3 categories, like a stoplight: green, yellow, and red. So if you look at the green, it's I'm having a good day. My breathing is good. I've been using my inhalers as prescribed. I haven't been getting short of breath. So you're in the green zone, and just continue doing what you're doing. The second one is the yellow zone, and this is when things start to change. So I'm having a harder time breathing. Maybe you're using your inhalers more often. So if you normally use your rescue inhaler once a week, now you're using it every day. Maybe you feel like you're getting sick with a cold. This means you're in the yellow zone, and you need to really pay attention because your body is giving you some warning signs. So this would be a time to call your doctor and just let them know what's going on, and then see if they want to prescribe you something different. Okay? Have you ever used a steroid before called prednisone?
No.
Okay, so this is just a steroid that sometimes doctors will use when you're getting sick with a flare-up. Now the third zone is the red zone, and this one is very bad. It's very serious, and you don't want to ignore when you're in this zone. So this is when you can read the description there. I'm feeling really short of breath. Maybe your medications aren't working. You're using your inhaler and you're still short of breath. This is very serious, and you need to call your doctor right away, or even if needed, call 911.
Okay.
Okay. Well, I think we have a great start here, and take all this information home and look it over, and please call me if you have any more questions. Is there anything I can answer for you right now?
Not currently, no.
Okay, great. All right. Well, it was a pleasure meeting you, and I look forward to seeing you again.
All right, thank you so much.
Thank you. Bye.